Hi, I'm Rod Kurthy, and we're here at the Greater New York meeting. It's a wonderful meeting. It's wonderful weather out.
Yes, it is.
For this time of year. And I have Dr. Bob Popkin, who is a user of the KoR system. Bob, you are talking to here dentists and dental staff members that have heard about KoR Whitening, but they've never tried it before. And I know you were just standing there just now, and you're in your animation. Yes. You were telling me about a few patients, and so. If you were talking to a good friend of yours who's a dentist that was asking about our system, what would you tell them? And tell the people watching here how it's worked in your practice. Tell them anything. Tell them anything about the system that you think they ought to know.
Okay. Initially, I thought the whole bleaching thing was a little scamish. Bright smile and all that. Sorry, dirty word. Sorry about that. I stayed away from it, and I had a buddy who had tetracycline, and he was great track lines. So I said to him, you want to try, be a guinea pig? And he said, okay, and we did it, and it works. It took 10 weeks, not 8. It was a little longer, but
he was a severe case, right?
He was a severe case, and it was wow. He said, wow. I said, wow. It was wow. After we did that, wow, and it really was, then a woman patient of mine who had brown track lines, I suggested to her, and I showed her the book that you sent me, and she said, I want it. I don't care what it costs, I want it. I said, but isn't it kind of light for you? She said, I went around with brown teeth my whole life, I want it. So I said, let's try it. And we did, and we got wow.
Cool.
And after 2 wow tough cases, she was tetracycline too, I just got turned on to it, and it gives people a whole new take on life. They can smile, they're not brown and gray.
Yeah. And it's great because, and it's funny because a lot of, I don't know why, but a lot of dentists start our system because of tetracycline. And we're not a tetracycline stain whitening system. We're just a whitening system for everybody that happens to be so effective that it'll work there. But when you see what it does even on tetracycline, and then when you're using it on your regular patients, and they're going, wow, it's fun to hear comments like that.
But you're the only system that deals with tetracycline. Patients come and they say, we tried a whole bunch of different things, wasted money, wasted time.
Exactly. Yes,
but
of course.
You're the guy that makes it happen.
Yeah.
And that's a wow. I mean,
that's
it's a great thing. People are really happy about it. I'm happy about it. I feel good because you feel good. You gave people a good service, and they have a new take on life. They can smile.
And what I've found in my practice, it's really great. And people get excited that have kind of average color, and then their teeth get really white. But yes, when you have these people with real problems with fluorosis and with the dark spots of fluorosis, and or your white spotted cases, or your tetracycline, where they really don't want to smile, and now all of a sudden you can change them.
It's great.
Oh, it is. Then instead of being life enhancing, it's life changing.
It's life enhancing and life changing. Yeah. For the dentists who are listening, you have to follow the rules and learn a little bit. Technique wise, have a little patience and follow through. Also, his technique on sensitivity, to remove sensitivity, call him, he'll tell you about it. It's great, it works. Which was a shocker, and it really does work.
And of course, for those watching, the desensitizer is part of the kits. Every kit comes with a desensitizer. It's used in the office, but it's used by the patients at home every single day. And it's nothing's perfect. But
it's a great system.
But wow, it does help, doesn't it?
I can't recommend it enough. It does take time. Visit one, you take special impressions, you have to learn the technique and use their materials. 2 or 3 weeks later, you get all the stuff in the mail in a big styrofoam box with ice in it and stuff like that. And you begin. And then every week, 2 weeks, and they call you and see how you feel. 4 weeks, 6 weeks, 8 weeks, and then the final one. And if it's not exactly quite right, you do a little bit more. And it worked for us, and it's just been a great experience, and I can't recommend it enough.
Good. And just in ending, I just want to be sure everybody understands that what Bob's talking about as far as the 8 weeks, etc., those are on difficult tetracycline cases. The normal, your 29 out of 30 cases, it's only 2 weeks.
2 weeks. And you get a wow, doc, really wow, and it just feels really good. Great. And plus, you can charge some money for it too.
Well, Bob, thank you very much.
Thank you.
That was a great, wonderful. Anyway, thank you everybody for watching. Bye bye.
Bye bye now.